Hi, we're Three's Company. I'm Kristen Thompson.
I'm Travis Turrentine.
And I'm Mike Fuson.
I'm Nicole Dunbar.
We chose strategies for managing nurse stress and burnout as our leadership and management related problem.
The profession of nursing is experiencing what some would call a crisis due to both reduced manpower and the inability to avoid the damaging effects of stress and burnout.
Lewis and Cunningham define burnout as a psychological syndrome of exhaustion, cynicism, and inefficacy which is experienced in response to chronic job stressors. Physical, social, and psychological stressors are continually present in the nurse's work environment.
Many nurses talk about burnout in terms of being overworked, emotionally exhausted, frustrated, and less productive both at work and at home.
Stress is a leading component of burnout and can be defined as a response to any pressure or demands.
Nursing burnout and stress has become a major focus for nurse researchers and nurse leaders due to high nursing attrition rates. A primary goal of nursing leadership is to retain nursing staff because the high cost of recruitment, orientation, and position coverage in the interim are all dependent upon it.
Researchers have also studied the negative effects of burnout, which vary from job dissatisfaction, anxiety, to patient dissatisfaction with care, decreased nurse-rated quality of care, and increased risk of negative patient outcomes.
Our group chose this problem based on our own personal experience with nurse burnout and increased work-related stress. We also understand that it is very important for nurse leaders and managers to be aware of and have a plan for this issue as well.
We feel very passionate about and confident that we can make a difference in the profession of nursing by implementing a holistic, comprehensive, and inclusive plan to reduce nurse stress and burnout.
Two commonly researched solutions that nursing leaders can use to help their teams better cope with stress and burnout are mindful meditation and the practice of yoga.
Davies defines meditation as a space where everything happens and an individual is completely aware and happy. Mindful meditation is based on the ancient tradition of vipassana, meaning to see clearly, and encompasses being present in all situations without judgment. The regular practice of meditation can provide many positive effects, such as increased mental clarity, improved concentration, and the ability to resist everyday stressors. The National Institute of Health reported that extensive evidence exists that meditation interventions are associated with improved health outcomes among the clinical populations.
Although mindful meditation is an amazing strategy to help nurses reduce stress and burnout, our group chose yoga because we found that yoga encompasses meditation. Yoga incorporates postures, breathing exercises, meditations, chants, visualization exercises, and selfless service into the adaptable solution of managing nurse stress and burnout. Yoga can be used in a team setting or individuals can use it in their personal time.
Yoga was invented in India about 4,000 years ago as a mind-body intervention. There are 5 traditional yoga forms of yoga, and Hatha is the one most practiced in the United States. Hatha simply refers to the practice of physical yoga postures and can be translated in 2 ways: willful or forceful, the yoga of activity. Hatha practices designed to align and calm your body, mind, and spirit in preparation for meditation. Yoga can be practiced by anyone, no matter what their physical capabilities are. Although yoga is relatively new to the healthcare field for the management of stress and burnout, minimal research has determined that it decreases stress and burnout rates in nursing. In the article, The Effectiveness of Yoga for the Improvement of Well-Being and Resilience of Stress in the Workplace, the results of their 6-week trial program showed substantial positive effects on the emotional well-being and resilience to stress among participants. With the decrease in stress, the burnout rate decreases, as well as an increase of employee retention. With a better retention of staff, costs associated with training new staff and replacing lost staff with agency nurses until the new hires are thoroughly oriented and are, I can't read that, I'm sorry, decreased. It has been found that it costs approximately 100 to 200% of the nurse's annual salary to train a new hire. Nurse retention through stress and burnout management is critical for this very reason, and yoga is a great solution for this problem in many instances.
We feel that in addition to policies that support positive changes in nurses' work environments, hospitals need to implement occupational health strategies that foster self-care and resilience in the practice setting. Nurses who practice self-care, self-reflection, and self-discovery are empowered to manage complex clinical situations with resilience, which leads to higher quality of care for their patients.
Alexander et al. States that the practice of yoga is a clear strategy for nurses to manage stress and build emotional resilience. Nurses in many specialty areas have reported improved outcomes after implementing mind-body techniques over time. After a 10-week mind-body intervention, med-surg nurses participating in a mindfulness training program reported less burnout and stress than their control group. The experimental group reported higher patient satisfaction than the control unit during the same time frame. In addition, nurses working on a pediatric intensive care unit who practiced a 5-minute mind-body intervention on the job reported decreased stress and burnout over time.
As leaders, we want to implement the practice of yoga in our places of work and with our fellow nursing students. We would plan to do this in our work facilities by working with the nursing education department to find certified yoga instructors to teach regularly scheduled yoga classes to employees. We feel that it would also be beneficial to fund the certification of any nurses or other employees who may be proficient enough to teach these classes. We would suggest that courses meet criteria that allow nurses to receive continuing education credit for the classes as well. These programs already exist and would be easily integrated into our education plan.
For now, we'd like to each share a stress reduction yoga pose that can either be practiced while standing or sitting in a chair. We want to begin implementing our problem-solving solution by sharing what we have learned with the class.
The first pose we will demonstrate is the standing forward bend. Often used as a transition between poses, the standing forward bend has many benefits when practiced as a pose in itself. The posture stretches the hamstrings, thighs, hips, and is thought to relieve stress, fatigue, and mild depression. Our goal is to de-stress in this pose, so it's best done with the knees slightly bent. It's great for the legs and a lot of different physical things, and it also allows us to calm the mind. You're reversing the blood flow and just hanging out. A modification for this pose is bending at the knees. Another modification is to use the block.
The next pose is the eagle pose. The active empowering eagle pose can help ward off stress by improving concentration and balance, and also by opening up the back and the hips and the shoulders, reduces stress. Eagle is an empowering pose because it releases tension in the shoulders, legs, and back, and it does require focus for you to remain balanced in it. You're literally squeezing the tension out of the body. It's a very active de-stress move. One modification for the eagle pose is to use the support of a wall. Another modification would be lying on your back. These are very good if your balance is an issue. To stay balanced, you want to repeat on the opposite side of the body.
Our third pose is one of the foundational poses, the triangle pose. According to the Yoga Journal, it is an excellent stress reliever and full body stretch. It can also help improve digestion and potentially decrease the symptoms of conditions like anxiety, osteoporosis, and sciatica. There are 3 modifications that can be implemented with the triangle pose. Bracing your back torso against the wall for unsteady balance. Placing your back heel against the wall to help with your balance also. You can rest your back hand on a block or chair.
Our last pose is the tree pose. With this pose, you aim to achieve the rootedness and firmness of a tree. Regular practice of this improves concentration, balance, and coordination. Because the weight of the entire body is balanced on one foot, the muscles of that leg are strengthened and toned as well. One modification for this pose is to hold your hand against the wall or to just balance yourself against the wall to help with balance. Another one to make this position more difficult is to raise your hands to the sky. This position can also be performed while laying on the floor. In addition, you can just lower your leg and rest your foot on the ground.
So, as you can see, stress and burnout reduction are very important topics that leaders and managers need to address. Yoga is a very beneficial means of helping solve this problem for nurses and their colleagues. Also, keep in mind that some nurses can integrate some of the yoga practices into the direct care of their patients. Many nurses who learn yoga as a stress and burnout reducer can go on to teach their patients yoga to help alleviate symptoms of their health problems and to renew their state of mind. We hope you enjoyed learning about this problem, a means for managers and leaders to help decrease the problem, and had fun practicing with us.
In class, we will demonstrate our strategy by leading a mini yoga session guided by PowerPoint presentation as our creative strategy.